Also, from next week, I don't know how this will be received, but the 11 a.m. information will be done by health staff through video link, as occurred before, and Minister Hazzard or I will intermittently hold press conferences as required. So the weekend, Sunday will be the last day we officially do the press conferences in this way, but from Monday at 11 a.m, Health will provide their daily updates with all the figures, and myself or Minister Hazzard or any other relevant minister will present to the community on a needs basis. But I just want to give this strongest message, if I can, and that is we can't afford to have people let down their guard. All the work we've done in planning, all the work we've done as to what we'll be able to do at 70%, and then obviously once we present the 80% double dose, is based on the fact that these restrictions remain in place until otherwise advised. Because if anything happens contrary to the modelling or what we expect, we don't want to have to revisit anything. We want to make sure that all of us enjoy those great things that we're looking forward to when we hit 70% double dose vaccination. And we are, as the model predicted, at a critical stage, because we envisage that once we get through the middle of September, all those people that have been vaccinated are going to kick in the numbers and show that the spread's reducing. One local government area which unfortunately has seen a spike in the last few days is Canterbury Bankstown, and we just want everybody in that area to be extra cautious. There was some stabilisation there, but the cases have gone up a bit. And Dr Gale wanted us to also call out parts of the inner city. Redfern and Glebe and the like are showing some indications of increasing cases. So please be on alert. Do not let down your guard. We are doing incredibly well as far as vaccinations are concerned, but please follow the health orders. And if you're home and are breathless, you should be ringing one of Commissioner Morgan's people at the New South Wales Ambulance 000 to make sure you get to hospital, because deterioration can occur very quickly. And make sure that if you experience breathlessness as part of your symptoms of COVID, that you contact emergency services. So I'll allow Dr Gale to give the health update. The Deputy Premier will then talk about the regions and, of course, confirm arrangements regarding those parts of New South Wales that are coming out of lockdown. And then Commissioner Morgan will talk about the ambulance service and the response. Thank you.
Thank you very much, Premier, and good morning, everybody. Till 8 p.m. last night, there were 1,542 locally acquired cases of COVID-19 in New South Wales, and there were no overseas acquired cases. We still continue to see great testing numbers with 133,226 tests reported till 8 p.m. last night. Currently, there are 1,156 people with COVID-19 admitted to hospital in New South Wales. 207 people are in intensive care, and 89 of those are requiring ventilation. Of the 207 in ICU, we continue to see the majority of people who are not vaccinated. Sadly, we report today the deaths of 9 people who had COVID-19. They are a man in his 60s from Western Sydney, a man in his 70s from southeastern Sydney, a woman in her 40s from southwestern Sydney, a man in his 70s from Sydney's southern suburbs, a woman in her 50s from Central Coast, a man in his 60s from Western Sydney, a woman in her 80s, also from Western Sydney, a man in his 30s from Nepean Blue Mountains, and a man in his 50s from southwestern Sydney. All of these individuals had underlying health conditions. 3 were fully vaccinated, 3 had had 1 dose of a COVID vaccine, and 3 were unvaccinated. As we've seen today as well, a number of those 9 individuals were younger people, and it's an important reminder for everybody in the community of the need to get vaccinated, to be aware that COVID-19 causes serious illness, hospitalisations, ICU admissions, deaths. So please do come forward to get vaccinated. To the families of those 9 individuals who passed away, I'd like to offer my sincere condolences for your loss on behalf of New South Wales Health. Today, we continue to ask our communities in areas where we've had sewage detections and no known cases to please be vigilant for symptoms and come forward for testing. And they are people who live in Tamworth, in Lightning Ridge, Glen Innes, Culburra Beach and Moruya areas. As we've announced previously, we continue to see high case numbers in suburbs of southwestern Sydney and western Sydney, particularly Bankstown, Fairfield, Greenacre, Liverpool, Punchbowl, Auburn, Guildford and Marylands. So for residents of those areas, if you haven't already booked in for your vaccination or had a dose yet, please do so as soon as you can. And as the Premier mentioned, we remain concerned about some emerging suburbs in the City of Sydney and inner west areas. So if you live in those areas, similarly, please book in for your vaccination. Please be vigilant for symptoms. Please come forward for testing. Thank you.